Hello, and welcome to this session about professionals and services and discomforts. Today, we will talk about these subjects: the various follow-ups and professionals, the various tests carried out, the various programs related to maternity, vaccination and pregnancy, medication and pregnancy, dentist visits, frequent discomforts, and tips to reduce their impact. A constant medical follow-up is important at every stage of your pregnancy. Whether you choose a follow-up with an obstetrician, family physician, or with an obstetrician gynecologist, the first appointment generally takes place during your first trimester. The first visit is usually longer than the next ones. Your physician will ask you questions to learn more about your health background. They will also suggest passing a physical examination. Then, the frequency of pregnancy follow-up visits may vary. If you have specific health problems, more frequent visits may be necessary, but in general, this is what the schedule looks like. Between 12 and 30 weeks, one visit every 4 to 6 weeks. Between 31 and 36 weeks, one visit every 2 to 3 weeks. From 37 weeks until childbirth, one visit per week. These visits are usually shorter. Your physician will ask you about how your pregnancy is going, and will check your weight, your blood pressure, your fundal height. We start measuring this around 20 weeks into your pregnancy, and your baby's heartbeat. These meetings with your physician are great opportunities to ask questions and express your concerns. Several physicians work in teams. You can ask your physician how their team works and who will be present for your delivery. Various tests and examinations will be offered to you during your pregnancy. For example, your physician may prescribe blood sample collections or urine analysis. Blood samples are used to check if you are anemic and if your blood sugar level is normal. Between 24 and 28 weeks of your pregnancy, you will get the opportunity to be tested for gestational diabetes. This test measures your blood sugar level right after you ingest a sweet liquid. Blood samples also allow us to detect infectious diseases that could be transmitted to the baby, and if you have antibodies against rubella. Blood samples also allow us to detect what your blood type is and what your rhesus factor are. If you are Rh negative, certain precautions must be taken. At 28 weeks and sometimes after childbirth, you may receive Rh immune globulin, also called Winrow. You may also receive it if you have a miscarriage, if you undergo amniocentesis, or if you have bleedings. Urine analysis are used to check if there are bacteria in your urine, even if you have no symptoms, and if there are proteins in your urine. Based on your condition, additional tests may be suggested at some point during your pregnancy. Around week 36 of pregnancy, it will be suggested that you undergo a vaginal and anal swab test to check the presence of group B streptococcus. These bacteria are not harmful for the mother, but they may cause problems for the baby in rare occasions if they are not treated. If the bacteria are present, you will be offered an antibiotic treatment during labor. The routine ultrasound is used to determine the gestational age and your estimated date of delivery, verify your baby's size for its age, observe most of your baby's organs, heart, liver, stomach, bladder, brain, etc., and limbs, check how many babies there are, and determine the location of your placenta. At the time of the ultrasound, it is often, but not always, possible to learn whether you are expecting a boy or a girl, even though there is a slight risk of error. If you want to keep it a surprise, inform the technician and the physician to avoid any misunderstanding. Trisomy 21 Prenatal Screening Program of Quebec. This prenatal screening is used to know the individual possibility of having a child with trisomy 21. It is free of charge, but not mandatory. There is no danger for the fetus. Blood tests with or without ultrasound. The risk of giving birth to a baby with trisomy 21 increases with the pregnant woman's age. Screening involves taking 2 blood samples from the mother and an ultrasound during the pregnancy. A first blood sample is taken between week 10 and week 13, and a second blood sample is taken between week 14 and week 16. Proteins and hormones from the baby or the placenta are measured in each blood sample. Both blood tests are important for the screening test. A single blood sample can be done, but two will give a more reliable result. An ultrasound is included to confirm your gestational age. If the result of the biochemical test, with or without ultrasound, shows a high probability, it does not necessarily mean that your baby will have trisomy 21 or trisomy 18. Other tests, which are more precise, will be suggested by your physician. Various programs related to maternity are available. The objective of the For a Safe Maternity Experience program, offered by the CNESST, is to allow pregnant women to work without endangering their health or that of their baby. If you have doubts about your job, your physician must fill out the appropriate form. The OLO program is offered to pregnant women and families who live in a context of economic vulnerability, and it provides them with a liter of milk, an egg, a portion of vegetables, and vitamin supplements every day. It aims for the adoption of healthy lifestyles, and it can start as soon as the pregnancy begins. The Integrated Perinatal and Early Childhood Services program for families living in vulnerable situations provides support to favor the children's overall development. It can be spread out from the start of the pregnancy until the child starts school. Several different professionals can provide support based on the expressed needs. If you want to have access to these programs, contact your region's perinatality nurses. The Quebec Parental Insurance Plan includes different parental leave models. For more details, visit the RQAP website. Certain vaccines can be administered to pregnant women, and they are even recommended. For example, the vaccine against the flu is recommended from the 13th week of pregnancy. In fact, a pregnant woman in her second and third trimester is more likely to suffer from complications from the flu or to be hospitalized. Pregnant women may even transmit the flu to their newborn. The vaccine against pertussis is also recommended for pregnant women. It is usually administered between weeks 26 and 32 of pregnancy. It protects the woman and her baby during the first months of the baby's life. The pertussis vaccine must be administered during each pregnancy. Based on your condition, other vaccines may be recommended during your pregnancy or after you give birth. Live attenuated vaccines, which are prepared from live attenuated infectious agents, are generally contraindicated during pregnancy. There is no risk in being around people who received a vaccine. Consult a physician during pregnancy in the presence of concerns, deterioration of the general condition, fever, suspected infection. We also recommend that you consult your physician if you had significant contact with someone who has chickenpox, measles, pertussis, rubella, and the fifth disease, if you are not protected against these diseases. It is recommended that you consult a healthcare professional before taking prescription and non-prescription drugs. Certain drugs may be ineffective, affect the pregnancy, or be dangerous to the baby. The use of acetaminophen for a limited period may be considered to relieve fever, pain, headaches, as well as flu and cold symptoms if necessary. You must respect the dosage and not exceed 4,000 milligrams per day. Because of the associated risks, the use of non-steroidal anti-inflammatory drugs is not recommended during pregnancy. Natural health products must be considered with the same caution as medication. Some of these products or their ingredients may be dangerous during pregnancy. The regulation is less strict for natural health products than for other drugs, and their exact content is not always properly indicated on the containers. Pregnancy brings physiological changes in women, which can lead to pregnancy gingivitis. Hormonal changes during pregnancy may exaggerate the gum's reaction to dental plaque irritants. Even a woman with adequate hygiene before the pregnancy may be affected. This is why preventive visits are recommended before the pregnancy or during the first trimester. In general, there is no problem in receiving dental treatments during your pregnancy. However, your dentist may suggest you postpone non-urgent treatments until after childbirth. Certain actions help prevent gingivitis. Brush your teeth for at least 2 minutes after each meal and sweet snack and before going to bed. Use fluoride toothpaste and do not forget to brush your tongue. Do not rinse your mouth with water and avoid drinking or eating for 30 minutes to let the fluoride adequately protect your teeth. Floss every day before going to bed. Pregnancy can bring its share of discomforts. Here are the most common: nausea and vomiting, constipation and hemorrhoids, heartburn and gastroesophageal reflux, leg cramps, back pain and sleep problems. Let's look at a few tips to relieve them. Nausea and vomiting are among the most frequent reported discomforts of pregnancy. First, you can change your eating and lifestyle habits. Eat before being hungry or as soon as you feel hunger. Eat a little bit before getting up in the morning, something like biscuits or crackers. Eat a high-protein snack before going to bed. Avoid skipping meals. Eat small meals more frequently. Avoid very fat or spicy food. Drink between meals. Then, non-pharmacological treatments may be used. Rest. Get up slowly. The effectiveness of ginger is proven. Pharmaceutical-grade ginger has a more reliable composition. The recommended dose is 250 milligrams, taken orally 4 times a day. Acupuncture, hypnosis, and meditation may be considered as they have no adverse effects on the pregnancy. However, their effectiveness is supported by very few studies, and the results may vary. A pharmacological treatment may be necessary. Vitamin B6 or diclectin should be the reference treatment. Because of their effectiveness and safety are further demonstrated, you need to consult your physician first. Constipation is a frequent discomfort of pregnancy, during which the bowel movements are slowed down. The increased concentration of progesterone towards the end of the pregnancy plays a role in the reduced activity of gastrointestinal muscles. Certain normal physiological changes during pregnancy may cause constipation, including the compression of the colon by the uterus. The consumption of iron supplements may also be associated with constipation. It is recommended that you gradually increase your fiber consumption, fruits, vegetables, legumes, whole grain foods. Drink between 1.5 and 2 liters of water every day. Keep an active lifestyle and adopt good intestinal hygiene. Internal and external hemorrhoids are varices that form on the wall of the rectum and anus. They can be secondary to constipation, increased pressure on rectal veins during pregnancy, or the action of certain hormones on the gastrointestinal system. It is recommended that you properly clean the anal area after passing stool, take cyst baths with lukewarm water, and locally apply a cream or ointment such as a witch hazel compress or zinc oxide ointment. Pregnant women must not use castor oil because it may stimulate uterine contractions and it is associated with a risk of fetal distress if used before the delivery. During pregnancy, gastroesophageal reflux is likely to have multiple causes involving hormonal and mechanical factors. The increased progesterone level and the expansion of the uterus, which increases the pressure in the abdomen, causes a reflux of stomach fluids in the esophagus. To relieve it, you can raise your bed headboard by 10 to 15 centimeters. Eat lighter meals more frequently. Avoid foods like coffee, tea, chocolate, soft drinks, and mint, as well as many fat or spicy foods. Eating or drinking at least 3 hours before going to bed. Lying down after eating. Wearing clothes that are too tight. If these measures are not enough, certain pharmacological treatments can be used during pregnancy. Discuss it with your physician or pharmacist. About 30 to 50% of pregnant women suffer from leg cramps. These cramps are unintentional muscle contractions that cause pain in the calves or feet. They mostly occur at night and become more frequent during the 2nd or 3rd trimester. When you have a cramp, you can stretch your leg while bringing your toes upwards, massage the painful muscles, Get up from your bed and walk. Do not worry if you feel discomfort or mild pain the next morning. This pain is harmless. 75% of women will experience back pain during pregnancy. In a good standing position, the pelvis is tilted forward at a 30-degree angle. In pregnant women, this angle is modified by the increased volume of the uterus, which moves the center of gravity forward and downward. The pelvis keeps tipping forward. In order to restore the balance, the pregnant woman tends to stretch her back downwards into a sway back position, which creates lordosis. Lordosis is responsible for most back pains. To avoid this, tip your pelvis backward by contracting your abdominal, gluteal, and pelvic floor muscles. The practice of various physical activities on a regular basis can help prevent back pain during pregnancy. You can also strengthen muscles and improve flexibility in your back and abdomen. Adopt and maintain good posture. Avoid lifting and carrying heavy objects. Sleep on a firm mattress. And avoid keeping a static position for long periods. During the perinatal period, women are more likely to experience troubled sleep periods. Sleep troubles are often caused by physical and hormonal changes, but psychosocial factors may sometimes affect the quality of sleep. If your daytime activities are affected, here are some ways to have a better sleep. Have a regular sleep schedule. Avoid taking long naps or taking naps late in the day. Make sure your environment is appropriate for sleeping. Do physical activity on a regular basis, preferably 4 hours before going to bed. Avoid stimulants like coffee, chocolate, etc. And finally, leave your worries outside of the bedroom. If troubles persist and affect your quality of life, there are pharmacological and natural treatments, but you first need to discuss it with your physician or pharmacist. During pregnancy, discomforts are frequent and often minor, sometimes troublesome, without risk for mommy and the baby, and often relieved by adopting healthy lifestyles. For any questions regarding the content of these prenatal capsules, you can contact your region's perinatality nurse.